Good afternoon to the daily briefing at St. Clair County EMA on this soggy Sunday afternoon. Today is our question and answer session, so we're going to get into the numbers for the last 24 hours. We got quite a few questions that came in, so we hope you stay with us. And if you submitted a question, hopefully we'll have the answers for you. If not, we'll get them to you. Sam, welcome back.
Thank you. So again, numbers of today. And as we've said the past couple days, we're still feeling pretty good about where we are tracking with our numbers for the county. As of today, we are at 4,844 St. Clair County residents that have been tested with 875 positive test results. And that is an increase of 25 from yesterday. And that includes both males and females from under the age of 10 up to their 70s. We are at 3,947 negative test results with 22 still pending. And we do have some sad news to report today. We are reporting one additional death, which brings the total to 68 for St. Clair County. And the new death that we are reporting is a male in his 70s who did have underlying health conditions. And as always, our condolences go out to that family. For those individuals that have completed the 14-day IDPH required quarantine period, we are at 455. For state totals, we have tested 542,172 individuals with 94,191 positive test results, which is an increase of 1,734 from the previous day. And we are reporting 4,177 deaths, which is an increase of 48 from yesterday. Hospitalization numbers for those hospitals that are in St. Clair County. Currently, we have 55 patients that are admitted due to COVID-related reasons, and 2 of those patients are on ventilators. For congregate living facilities that are in outbreak status, and that means 2 or more staff or residents that are either COVID positive or who have COVID-like symptoms, Brea of Belleville has 23 cases and 2 deaths. Brea of Cahokia has 8 cases and no deaths. Caritas Family Solutions in Belleville has 7 cases and no deaths. Colonnade Senior Living in O'Fallon has 3 cases and no deaths. Four Fountains in Belleville has 103 cases and 17 deaths. Help at Home in O'Fallon has 5 cases and no deaths. Knollwood Retirement Center in Caseyville has 6 cases and no deaths. Lebanon Care Center in Lebanon has 51 cases and 9 deaths. Memorial Care Center in Belleville has 43 cases and 5 deaths. St. Paul's Home in Belleville has 10 cases and 3 deaths. Swansea Rehab and Care Center has 4 cases and no deaths. And finally, TDL Incorporated in Belleville has 4 cases and no deaths. And now I will turn it over to Chairman Kern for his update.
Thank you, Sam. It looks like the numbers are stabilizing in the congregate living facilities. That's good.
It is, and we're keeping our fingers crossed that it continues to stay that way.
Keep that going. Today we'll do the zip code reports. These zip codes, remember, are the zip codes that have more than 5 COVID positive diagnoses in that particular zip code. So here we go, 62201. We have 13. That number remains the same. 62203, we now have 28. That's an increase of 1. 62204, we have 33. 62205, we have 41. That's an increase of 3. 62206, we remain static at 76. 62207, we now have 55. That's an increase of 2. 62208, we now have 48. That's an increase of 1. 62220 has 94 now, and that's an increase of 3. 62221 now has 76. That's an increase of 2. 62223 remains at 43. 62226 has an increase of 5 today, up to 110. 62232 now has 14. That's an increase of 5. 62239 has 11. 62254 has 26. That's an increase of 2. 62257 remains at 8. 62258 remains at 14. 62269 remains at 61. And 62285 remains at 7. So We're ready, Herb, to launch into the questions?
We're ready. As I said, this is our question and answer day, and Chairman, I've asked Brian and Randy to kind of chime in today if there's something that comes up, because they are an integral part of this operation. I think they've been here every day, Randy.
Every day.
So, I mean, it's just kind of like every day runs right into one another. So let's get started. Brian, you're going to read the questions again this week. We appreciate that.
No problem. We'll start with Sam, as most questions come in. Or I shouldn't say most. A lot of the questions are health department related. And I know you always do your best to get the answers here, so we'll go through some of these. First one is, can COVID-19 be contracted through your ears?
So, not from any information that we have received up to this point, but this coming week, and I believe it is Tuesday, we will have another physician on the daily briefing, and we will be sure to bring up that question to get a final answer for you. But up to this point, we have not received any information that that is a way that you can contract the virus.
And I think that's a good answer because we're not the medical experts, and we said
Correct.
from day one that this thing is being led by the medical experts, so we will definitely try to get that answer on Tuesday.
Yeah, and Tuesday we do have that emergency room doctor with other medical professionals. There was some questions before about some of our guest speakers that, you know, this past week they were a lot of them that were busy. But this next week we have some more of those returning, and we'll hopefully be able to provide some additional guidance for that.
And I think the reason for that question might be that when you wear a mask, it doesn't cover your ears. Now, we did hear this week that, you know, certainly you can get it through your eyes, and that's the reason why you want to keep your hands off your face, keep your hands washed and all those things. So it'll be interesting to hear what the doctor says this week.
And, you know, as we've said from the beginning, this virus is evolving. What it is doing today, you know, 2 weeks ago may not have been the same. So, you know, we're learning about it as things progress.
And that's why we're getting those late night notices from the CDCs and IDPH. And I mean, when I say late night, you get them too. So, but we will get you an answer.
Sam, the next question is, are COVID positive patients after their 2-week isolation required to get another COVID test?
So for the general public, there is no guidance on if you should or should not get a second test. With that being said, we have several locations that are available for testing at this point that do not require you to have symptoms, that do not require you to have insurance to go and be tested. So as an individual, if you would like to go and be tested a second time or a third time, that's totally up to you. The only criteria that is out there from IDPH is for healthcare workers, and that is a specific set for those that are in the healthcare field requiring a second test. But if you're an individual and you've completed your 14 days and you would like to know for your peace of mind, you're welcome to go back to any of the sites that are open that do not require any symptoms to be tested, and you can get a second result.
Okay, thank you. When we talk about those that are asymptomatic, another question that came in says, you've encouraged people with no symptoms to get tested, but are they supposed to go back and continuously get tested? And if so, how often?
So again, you know, now that we have multiple locations that are accepting people that don't have symptoms, we are encouraging people simply because we are seeing the number of positives with people who do not have any symptoms. You know, you're feeling fine, and maybe you're just curious and you don't have anything going on that day, and you think, I'm going to run out to the Cahokia Walgreens and get tested, and surprise, surprise, your test result is positive, but you're feeling fine. So, you know, there's no recommendation, there's no guidance from the state on how many times you should get tested, but if you're interested, they're out there for you to be tested.
Well, I think we discussed that earlier. If you get tested today and you get your test results back and you're negative, if you're following the social distancing and the personal hygiene and you're staying at home, you're not going out, you're not going around other people, probably you don't need to. Now, if you're straying out and getting around somebody who, even if they're asymptomatic, then you may want to do that.
Well, and I mean, even if you think about if you live in your household with someone else, you both may feel fine, and maybe we both go get tested, and you come back negative and I come back positive. There's nothing to say that in a few days, that person that tested negative wouldn't be positive.
Exactly.
And so then the whole purpose is that you find out you're positive, and you remove yourself from the general population.
Exactly.
Which then keeps the spread from happening. It's one more way to lower these numbers.
Exactly.
Chairman Kern, question that came in here for you says, I live in St. Clair County, but I was laid off in Missouri and have past work history in Illinois. I can't get my unemployment until Illinois verifies my work history, and they have not got that done. How can someone get this problem solved, as I can't get through to Illinois because I don't have a case number? 2 months in and I have no unemployment.
So our sympathies go out with to you, during this time. So, as you've seen, or hopefully you have seen, we've had state representatives, state senators on here. Representative Jay Hoffman has always been out there, as have the others, with his phone number. I called him up, I read your question to him, and he said, have him call my office tomorrow. So, and this is for anyone who's having difficulties with unemployment. His number is 618-416-7407. Call tomorrow, and his office staff will be around answering calls, available for calls, and they can hopefully get you through the problems you're having to be able to complete your unemployment. Additionally, St. Clair County has programs for people through our grants department, so we encourage you to go on our website at the Intergovernmental Grants Department in St. Clair County. You can access assistance, power bill assistance, other assistance. So I encourage you to use the services that are available to you, and certainly the grants department services. You can access those, and you won't have problems getting through. And I would encourage you to call Representative Hoffman tomorrow also.
And Chairman, this is Randy off camera, but I can speak to that because I was able to, my wife was laid off, and I reached out to his office, and so did my wife, and they were able to help her get in contact with somebody to get the process moving, because as we know, they're inundated with these issues right now. So I personally would recommend that for sure.
Very good.
These are unemployment levels that we have never seen in the state before.
Never.
So it's the system certainly is burdened.
Chairman, another question that came in said, during a recent briefing, you stated the county had met the criteria to move to Phase 3, and a letter was sent to the governor asking that our county move to Phase 3 by May 15th. Did the governor respond to the letter, and if he refused the request, was there a legal reason?
So there was no refusal. We received, certainly the governor's office, the Illinois Department of Public Health reached out to us and, discussed the reasons for the letter. And what we had said was that we'd met all of the metrics that went into opening up into Phase 3 according to the governor's executive order. The only metric that we weren't consistent with was the requirement from the state, the Department of Public Health, that you have 28 days of hospitalizations, COVID-related hospitalizations that were going down. Well, because IDPH only started measuring that, or at least part of the executive order was that they would start to measure that on May 1, naturally. On May 15th, they only had 15 days of those statistics. Of course, all 15 showed hospitalizations going down. We then tried to approach them with the idea that we had been going down since April 15th, so that on May 15th we would meet that criteria. I think that the reasoning that the Department of Public Health had for saying we need to wait a little longer to make sure those numbers are accurate is that or at least that those numbers aren't going to change, is that when they did move to the next phase on May 1st, it opened up certain things. And so the state is being very cautious, saying that when things open up, we want to make sure it's not going to cause another spike, another hot spot that may occur in a certain county. And so they're taking a look at those numbers. They want to have 30 days of statistics as opposed to 15 days worth. It's worth talking about and debating about, but at the end of the day, there are doctors, there's scientists, there's leading health officials that are saying that they need to have 30 days or 28 days, actually, of those numbers. So it appears that we're going to be in this current phase until the 28th, but we continue to talk. And of course, every day the statistics that we have here, they don't remain here on this table. They're all being shared up in Springfield and in Chicago and throughout the state. And we believe that certainly we're going to move into the next phase, and we're going to continue to ask to be expedited to move into future phases if our numbers are as they are today, where they appear to be at least plateaued, if not starting to go down a little bit.
Well, Chairman, I think you need to express and explain to them it's just not St. Clair County. We're a part of the region that was set out. And so we're not just looking at everything in St. Clair County. When we talked about, there were some questions about, well, Madison County was going to do this and they were going to open up. And we saw last week where a lot of their larger cities over there said, we're going to follow the executive order because we want to make sure that our citizens are safe also. And one of the questions I seen posted the other night was, well, why won't Chairman Kern just open the county back up? And I think you have explained that time and time again since we started this.
But you're right. The executive order is the law. And if someone violates that law, then they do so at their own peril, at the peril of a state license, if that is something that they're required to have to open. Their insurance coverage may go away. All of these things that as the leader of St. Clair County, I'm not going to walk people down a path of illegality. You've got to, we have to go by that order, and the only way that we can hopefully get things moved up a little bit is that we talk about facts. We don't talk about politics, and we don't talk about other things. It basically is, what are the scientific facts? What are the doctors saying? What are the recommendations? And how can we justify opening up sooner? And then after we open up, we got to remember it's going to be imperative that we all continue to do the things that we're doing right now. We can't slip back into not wearing masks. And by the way, I got to give credit to my wife, who has made me my first mask, homemade mask.
Yeah, I didn't like you wearing the other ones. I'm glad you got the homemade one.
Well, there we go. Yeah, they're fancy. Thank you, Aaron. But we've got to do all these things. Otherwise, these numbers are going to go back up. There is no doctor that I have talked to or that I've heard about that doesn't think that opening up is going to cause numbers to go back up.
Well, and that's what I think is just so important. You're not, and we said this the other day, you're not sitting there making that determination on your own. The governor is not doing that. There's task force out there. You are in contact with Sam, the health department, multiple times a day, with the hospitals.
With our state
with
senators and state representatives who are all very active and who understand that business has to survive this. I want a haircut. I want it to open up, but that's because you need a haircut.
I want to do it safely, though, for all of us, and but I just wanted to throw that out there. It's we're doing it slowly, methodically, and I know some don't agree with it, but I think when it comes down to it, we're doing the right thing based on what science and those medical experts have told us.
And we're less than 2 weeks away from
if we don't get
reaching that next phase, as long as we continue to do what we're doing and our numbers continue.
And again, it's worth mentioning, all of our local leaders, we have those conference calls with the mayors, and they all, the ones that have joined us every week, have said, yeah, we want our towns to open up. I talked to the Marissa mayor today. Everybody is anxious to do that, but they also know, kind of like what you said, they're doing what's best safety-wise for their constituents.
Okay. Director Simmons, a question came in that you might be able to answer here. Will the prisoners, particularly the murderers that were let out of prison due to COVID-19, be put back in once we are in a safer phase?
Well, we don't have nothing to do with that. That was a decision was made, of course, by the state and the Department of Corrections, and for whatever program they came up with, that's strictly what I wish we had something to say about that.
But our state's attorney was on here.
State's attorney
in St. Clair County, the ones that need to be in jail are in jail. If there were ones that were certainly nonviolent and weren't.
Sure, we didn't release any of those type of prisoners.
Right, no, it wasn't here in St. Clair County.
No.
I don't know
where they're talking about, but okay.
Director, as you just talked about a minute ago, your conversation with the mayor and Marissa today, one of the questions that came in said the Dollar General in Marissa is not requiring employees or customers to wear a mask. Is there anything that can be done about that?
Well, yeah, the mayor was right on that. There was a couple of complaints that came in. when he went down there. In fact, he took a picture of the clerk in the Dollar General store there in town, had a mask on. There was a customer there. So, there's people out there that maybe at the time that they had been there when those calls came in, but I got to give Mayor Easton credit. He was there within 10 minutes and sent a picture here to the center, and so we appreciate him doing that, and we appreciate the folks at Dollar General having the mask and the customers that was in there.
Okay. Sam, back to you for a couple here. It says several people are getting antibody testing. Current reports are showing that antibodies from previously infected people are being used in currently infected people to help them recover. The results of antibody testing are being reported to the CDC and local health departments. Are these positive and negative test results being added to the number of positive and negative results for COVID-19? I know someone who tested positive for having antibodies and a person who used the same lab and tested negative. I should have my results next week. If this form of testing indeed shows who previously had it and those that haven't, and the results are being reported, can they be added to the daily statistics?
So that's a very good question. And yes, we do count those results that we receive for people that test positive for the antibodies. We do add that to the numbers that we give you on the daily briefings, as well as IDPH includes those on the numbers that they update on their website as well. And one of the reasons that we track this, as Brian had said earlier in the question, someone that had COVID-19 in the past and has completely recovered and is feeling fine, we can take blood from them and spin it out and then give those antibodies to someone who is currently sick and helps them recover faster and hopefully bounce back quicker. So while we're doing that, we are looking at future, treatments from this. We're looking at, how can we help keep this to a minimum, because a lot of the health professionals have said that once we see our numbers go down, that's not the end of it for COVID-19. It's not going to just go quietly into the night. At some point, we will see a second resurgence of it, and hopefully at that point, we will have more information, more treatment options, but that's the reason that we are using the plasma from those who had been previously COVID positive, and moving forward, that hopefully we'll be able to tailor even more specific treatments from that.
Okay. Another one that's come in says, the state reports ICU bed utilization. Does that include non-COVID patients?
So for IDPH, when they report ICU patients, that is all of ICU. That does not include just COVID patients. But the numbers that we give you on the EMA briefing for St. Clair County, those numbers are COVID specific. So I believe today we were at 55 patients, and that is patients that are admitted due to COVID related reasons. So yes, ours are COVID specific.
Well, I think, Sam, to that point, yes, they're reporting all ICU beds because people aren't just getting sick from COVID-19.
Exactly. There are still other illnesses and diseases that are going on. They don't take a break just because COVID's going on.
And when they're looking at their surge numbers, regardless of why the patient is in ICU, they need to make sure that there's enough beds if they needed those surge capacities. So you can't just kick out people that aren't COVID-19.
Exactly. Yes.
Okay. Another question that come in is, when will all healthcare professionals get tested by their employer?
So the guidance that is out and that has been for a while with IDPH assures frontline health workers that they can be tested. Now that could be, specific to their policy and procedure depending on what type of frontline medical worker you may be. Perhaps a doctor's office might have a different policy and procedure than an ambulance company. And perhaps the emergency department staff at a hospital might have something different. So while it's available for all healthcare professionals to go out and be tested, it may be specific, and your own employer might have specific guidelines in their policy and procedure. So if you have questions and you are a medical professional, it's best to check with your employer to see what policy and procedure they've put out for COVID testing.
And questions that we get a lot resolve around our long-term care facilities, and as far as, is there a requirement that they all be tested, or is that just an effort that we're pursuing as a matter of trying to determine how far this illness has progressed?
It is an effort that we are trying to pursue and are getting ready to go at that pretty hard, because we look at the long-term care facilities. those residents aren't able to leave the facility to be tested. So what we're going to be doing is we're going to be bringing the testing to them. And we are working on getting that ball rolling so we can get all of our long-term care facilities in St. Clair County tested.
And you've already started that.
We have, yes, we have. And our goal is to continue to work through, believe we are at 47, and that is not only long-term care facilities, but congregate living facilities that we have in the county. And we're working really hard to get, all those test kits out there, but doing it in a controlled measure. Because if you think about it, if a facility has 50 staff members and they test all 50 staff members at once and 30 of them come back positive, that leaves you only 20 people to run your facility. And so, we have to do it the safest way, not only for the staff, but for the residents.
Well, Sam, and I want to just go back to reiterate, that just shows more how complicated this is. When we were talking the one day about the tracing, this is another part of that puzzle that you just don't go out there and say, we're going to test everybody and we'll have everybody's results, because if half of them come back, those patients that are in there still have to be taken care of.
They do.
We had a situation at one of the long-term health cares where they were short-handed on staffing, and we had to try to help them through that. So I applaud what you are trying to do to work those logistics out, because it's going to be pay off in the long run, I think.
And when we talk about the staff at long-term cares, we're not just talking about the nurses, the RNs or the LPNs or the certified nursing assistants. We're talking about people in environmental that help clean, that help do the laundry, the cooks. No long-term care facility or any facility can run without those basics. Building blocks of staff members. So, we're trying to look at it from the big picture to be the most efficient, to get everyone tested, but also to keep the residents the safest we can with all their needs that they have still being met.
Yeah, and I think if, you talked about the ambulance and the first responders, if they want to be tested, they should be bringing that to their departments and saying, hey, if we're available, can we go get it done?
Exactly.
And it's with the input and cooperation of these long-term care facilities. They're helping you with this testing process.
They are. We've spoken with them. We find out, do they have COVID wings, depending on how the setup of their building is. I know one of our facilities, they've been able to dedicate one hall specifically to the COVID patients that they have in-house. And they keep the same staff, and that goes from the medical staff down to the cleaning staff. They work on that same wing to help prevent the spread of COVID throughout the rest of the facility.
And so that's how you're then able to go in and say, here's the part we're going to segment today to test,
Exactly.
and then tomorrow and the next day. That's how you decide how many to test.
Another question we hear about frequently, and it's something new we've started releasing publicly this week. It says, why is no one reporting the numbers of recovered cases in our state and county?
So, as Brian said, we are now starting to report recovered cases. I do urge you, though, when you look at different, whether it be health departments or different hospitals or whatever the facility may be, if they use the term recovered, be sure to look to see if there's an asterisk next to it, because they might have a description or an explanation below that to what they're talking about as recovered. For St. Clair County, when we talk about patients that we're not using the word recovered, we're talking about those that have finished their 14-day IDPH required quarantine. Other facilities may be using a different definition of what recovered is, and it's the reason we're choosing not to use the word recovered is that can be a very broad term. And depending on the person, my recovery might take 2 weeks, yours might take 4. So by putting that as a recovered term, it's a very broad umbrella, and we're just choosing to report something so it's a little different, but still giving you an idea of how many have completed their 14-day quarantine.
And that's all part of, what this program is every day is all put together by you and by Herb. And so we're able to think about these things on a local level. I mean, we're aware of a person in the county who has been totally symptom-free. They did have COVID. They recovered, if you want to think about recovered, but yet they still test positive.
Exactly.
Weeks after,
and multiple tests after as well. So you kind of have to take, when you see the term recovery, it's more you have to take it on an individual basis for the person, because we all recover differently, we all work differently, and so I just urge people that when they see the term recovered to look around that wherever the post may be to see if there's a more of an explanation as to what definition they're using for the term recovered.
Because how would you classify that person? They have recovered symptomatically, but they're still testing positive. So how would we report them on that list?
Exactly.
That's why we keep this to people who have gotten through the 14-day
Exactly.
quarantine.
Exactly.
Okay. Chairman Kern, another one here as it regards to executive orders and opening. Do you think that area public pools and or splash pads will be able to open at any point this summer?
I know the city of St. Louis, who seem to be moving in a little different direction with openings. They have said that the pools are not opening in phase 3 and phase 4 of the executive order. Phase 3, I think, limits the gatherings to 10. Phase 4 limits to 50. I would think that pretty well says that pools are not opening, but they really, as far as I know, nothing specific has talked about pools. But I would think that answer probably would be no for this summer, at least until unless something happens. If a vaccine is found, if a treatment is found, it's kind of hard to predict July and August when swimming pools can be open and are usually, certainly are open. Even if you open a pool late, if you can still get August and September in the mix, you're doing pretty well. So as of now, it certainly isn't going to be in the next month, but later in the summer, if things keep going in the way they are, and if there is a significant medical breakthrough, it may happen. But as of now, the guidance says not now.
Okay. Another one that came in that says, can you address the governor closing up St. Clair County for 5 months?
Well, it may feel like 5 months to many. I know to my mother it feels like an eternity, but it's been 2 months, and it's been hard. It's been hard for people to stay in. It's been hard for our local businesses. They're suffering. All business is suffering. And this virus, which was no fault of anyone that's in discussions. It wasn't created by anyone. It came here and it's attacking this community. The one thing this virus does well is it is highly infectious and highly contagious. And so all of the things that have been done, all the rules and orders that have been put in place have been designed to try to slow the spread, keep it from peaking and overburdening our healthcare facilities, and to keep it from spreading so far that it causes a death rate even more than what we have now. We have way too many deaths in St. Clair County. People that I know that have passed away from this. We want that to stop, and the way that stops is to listen to the healthcare experts, do what they say, and we get through this. We get businesses get to open, and we get life back to more normal than if we decide to take it on ourselves and open up without utilizing the recommendations of the healthcare experts.
Thank you, sir. Director Simmons, a question that came in here was, will stores be required to turn away customers who are not wearing masks? I see many people not wearing them now, and I can only imagine as the county continues to open what that will do for spread if stores don't enforce the mask requirement.
Well, stores are they're going to have to impose their own requirements, and they have all the right in the world to do that. And my recommendation is if you're following those recommendations, and if there's one of those stores that aren't, find someplace else to go that is, because we want people wearing the mask when they're out, what's being recommended. And if stores aren't following it, but again, just like the situation today, people said, oh, this one store's not doing it, and in 10 minutes time we're able to show that they were. So I think there's just a lot of people that are stressed out, which we all know, and they're assuming that they may have been there at the wrong time. But if a store wants to impose it, they can.
Well, we see a lot of that. A lot of people, as we follow these comments every day, even the comments that are on here right now, there's a lot of people that are upset, they're discouraged, they're concerned at some of the economic impact they're suffering. Maybe they haven't seen the personal relation to the loss of life or the significant illness, so they're not understanding quite the complexity of this. But there are many, many people that are following exactly what is asked of them, and
Yes.
it really is a small percentage that are choosing not to follow, and some that can't medically tolerate a mask.
Well, and we talked about earlier, before we went on, this virus, and you said it a while ago, it's terrible, it's contagious. But I think if you stop and put it in perspective, what if we suffered a major tornado and it wiped out a good portion of our county? Homes are damaged, property is damaged. People are going to be they're going to be in the same boat. And people say, well, yeah, but they've got insurance. Insurance companies take time. I know for a fact, sometimes 3, 4, 5, 6 months before you see insurance. So this is something different, but you have to look at that. You know, when we're talking, you said it's been 2 months and it seems like an attorney. I agree with your mom. My wife says the same thing, but I'm not willing to gamble that. I was asking these Brian and Amir today, who do you want to sacrifice in your family? I don't. I mean, I want to follow what's been laid out in that executive order. If we're able to open up before the 29th, more power to us into phase 3.
Well, and as the chairman said earlier, that is something we continue to provide every day, the updates and the
Yes.
requests. And our goal is to hopefully be able to continue to move through these phases quicker based on the metrics that are here.
And so, just speaking as the chairman of the county, so we are hoping that the courthouse will open the end of this month, the 28th or so, depending on that date and exactly when we're allowed to go back. We have put infrastructure in the courthouse, plexiglass everywhere. We're having masks made for our employees to protect them. So really, these businesses should be concerned about their employees. If people are going into that business and they're not wearing masks, not only are the other customers at risk, but the employees are at risk. And so I know that the business owners in this community are going to protect their employees. They value their employees. So the incentive is there. It's just we got to, and the CDC guidelines are there. So we just need to get following those and do the right thing. As businesses open, there are going to be requirements. There are going to be restrictions. There are going to be distance requirements among tables and how close people can be to each other. Those are all things that we need to continue to enforce when we get into phase 3 and then hopefully into phase 4, which then gets us that much closer to life as normal.
Well, Herb, I think Dr. Ngaze Ezike said it best a couple weeks ago when she said, we're fighting an invisible enemy. And would it be different? Would people take this more seriously, or would they treat it differently if it was the enemy was soldiers out on the street that were, something that's visible? But because we don't see it, it's easy to become complacent and not take it seriously. And then that's how we end up creating more of a problem for ourselves and for our community and for our families.
Exactly.
Okay, Sam, the next one came in. We're back on a couple health ones here.
Okay.
Is there any reliable antibody testing happening in our area? I know we spoke a little bit about antibodies earlier, but is there any, as this person has, a reliable test available?
So there are several facilities around St. Clair County that are doing the antibody testing, but what they've received from the FDA, which is the Food and Drug Administration, as far as approvals, what they've received is an emergency authorization, which gives them the ability to test right now, but they do not have the full approval yet. So there's still a lot about this test that we could learn, and potentially down the road, the FDA may, switch gears on it. But right now, they do have an emergency use or authorization use to be able to test.
And there is a cost for that.
Yes,
Yes.
I do. I believe the costs I've heard have been between $150 up to $200. So I think it just depends on what facility you're going to.
Okay. I think we discussed this one earlier, but just to kind of circle back to it since it was asked here in a different manner. If I'm staying at home and have no symptoms, why would I ever be encouraged to get tested?
So as we said earlier, it's simply because we're seeing more and more people that don't have any symptoms, that feel fine, that have, when they've tested, have surprisingly become positive. So it's simply just a protection for you and those that live in your house to be able to get tested now that there are so many facilities out there that do not require you to have symptoms to be tested. Like we said, if you're bored one afternoon, go up, you can get tested, and at even one of the facilities, you can find out your results that same day, and which is the Walgreens in Cahokia.
Well, I think it's important to mention, I've seen some questions come in today and asked, we've talked about these multiple times, but there are several facilities here in St. Clair County. We have the Southern Illinois Healthcare Foundation that you call the screening number and they set up a time for you to come down and get tested. They're testing in Belleville at 7210 West Main.
Yes.
They're testing in East St. Louis at the Windsor Medical Building at 100 North 8th, and also in Cahokia at the Cahokia Fitness Center at 509 Camp Jackson Road. In addition to that, we have the BJC healthcare site that requires a doctor's order to get tested,
Yes.
but that one is in Swansea at 4100 North Illinois. And then we have the two other tests, the state-run test site, the Jackie Joyner Kersey Center in East St. Louis. That's the one that is running 7 days a week,
Correct.
8 hours a day, and they will test anybody with symptoms, anybody that's in a vulnerable population, anybody that is
A frontline
a
worker.
frontline worker, if you're at a grocery store, if you're a laborer, if you work sanitation, healthcare provider, they will test you.
They will.
And then we go to the Walgreens on Camp Jackson Road. I believe it's 1201 Camp Jackson Road. They will test anybody.
They will.
If you pull up and ask for a test, they will give you a test and give you results the same day.
Now, I will say that, with the weather that is going on today, I do know that they tried to go down to Cahokia Walgreens to get tested today, and because their testing facility is outside, they did stop testing today. But I do know that the Jackie Joyner Kersey site, as Brian said, they are open 7 days a week, 8 to 4, or until supplies run out. So if you do think that you're going to go to the Jackie Joyner Kersey site to get tested, best to go earlier in the day. That way you eliminate the possibility of going later in the day and perhaps them being running out for that day.
And the ultimate answer to everyone's question there, all these tests are free to the individual.
They are.
So there's no requirement of a copay.
Correct.
There's no money that has to change hands to get this test
Exactly.
on site.
Exactly. Yes, it does not cost you anything to go get tested.
Okay. Another medical question.
Okay.
What is the current advice about ibuprofen?
So there have been various reports about ibuprofen, using it if you are COVID positive, and we also have the other question that was asked earlier today about COVID. Can you contract it through your ears? We are going to write this question down, and the physician that will be here on Tuesday, we're going to talk about that question as well, because again, we are not healthcare professionals. We're going to leave those answers to the people that that have those good titles behind their name or in front of their name.
I would definitely still classify you as a healthcare professional.
Oh, well,
and
I'm
all
not
of
a
our
doctor.
health department is healthcare
Yes.
professionals, but we do tend to lean on some higher certified medical professionals
Sure.
to get more specific answers to some of these questions.
And the physicians that we have on the briefings, they are on the front lines. They are the emergency room doctors. They are the ICU
Doctors.
Yes, the doctors that are seeing these patients firsthand and seeing what this virus can do.
Okay. As we talk about those utilizing our frontline healthcare workers, another question that's come in that is very new here in St. Clair County is, have we received any of the remdesivir to treat patients here in St. Clair County?
So yes, what we have is we've received a small amount of remdesivir, which is the medication that is being used to treat COVID at this point. But we have not heard which hospitals received it and how those patients are doing. But St. Clair County, some of our hospitals did receive the medication.
Okay, very good. And as we've talked about on here, and we've talked about with some of the doctors that have been on here, there have been various types of treatment that have been proven, disproven, beneficial to some, not beneficial to others. This is a new virus even for the healthcare industry.
It is.
So while it's good that this is being made available to our doctors to help treat them, this is not the only treatment method they're reviewing at this time.
That is correct, and I believe it was one of the pulmonologists that we had on, I guess probably about 2 weeks ago. My days are all running together. But they said, if you remember in the beginning, the thought was that anybody that came in respiratory distress that was COVID positive, they were putting them on a ventilator, the tube down your throat to help you breathe. And that was the go-to form of treatment. And now they have somewhat transitioned into doing oxygen through the
High
nose
flow O2,
and
nasal
different
cannula.
types of interventions. And so, as we've said, we're learning about this virus. We're learning to adapt along with it as far as treatments. And it's not just a broad stroke of one thing is going to work for everyone.
Absolutely. Director Simmons, kind of on a resource front here, says, do you know of any place that the general public can purchase an N95 mask?
I would assume some of the hardwares and retail stores may have them, but I caution them. Remember, the N95 should be reserved for our healthcare providers, our frontline first responders, as opposed to a cloth mask, something like the chairman said his wife made him today. But the N95s is what we try to keep for our first responders and healthcare providers.
Okay. Chairman Kern, as we talk about all the different aspects of this virus, a question that we're seeing over and over, and it was posed today, is what is the financial loss going to be now that we see Missouri reopening?
So the financial loss of the whole virus episode since the beginning of March until now is highly significant in the county. Sales tax numbers, other numbers certainly are way off, and we'll be able to deal with that, and we are going to deal with that. As far as Missouri opening, I'm sure there's an impact. I'm sure there's some people that are buying some non-essential things that they just want to get out. It's not recommended, and the financial loss for that we might have if this gets prolonged, if our numbers start to spike, if we find out that perhaps Missouri opened up too early and our people are bringing that back across the river and things start to spike, that financial loss will be significant. People always go to Missouri. I mean, we all do. We all shop there. We all go to restaurants there occasionally, or when we feel the need during normal times. I'm sure some people normally go over. They have their favorite spots in Missouri that will be opening up. I do believe that the person who asked the question is correct. Likely, there are going to be some dollars going to Missouri that might have stayed here, but I think getting over the COVID virus, following this the medical guidance that created the executive order, I think it's a responsible thing to do, to follow the law, do what it says, and try to get through this. The faster we can get our businesses open, the more those revenues are going to start to come back. But you weigh the business interest with the health interest, and I think you've got to say that the doctor recommendations are the things that we need to do now so that we can make sure that once we open to the businesses, they can stay open, that we're not going to move backwards and say, hey, we better back off. I think that's the reason for the longer timeline in Illinois, is to make sure we don't take a step backwards, because the last thing we want to do is open up and then all of a sudden discover that it was the wrong thing to do, and we've got to close up again. When we do this, we want to make sure we're ready to move into the future.
Well, Chairman, I think something that a lot of the businesses that have chose not to open up in some of the other counties, if they have to get their supplies in, so we go in and we get all the new stock in, and then, like you said, all of a sudden we get a spike and they have to close back down, that's wasted money also. So the people who are saying, I'm going to ride this out a little bit longer, I think it's a smart business decision on their part. And I saw pictures of some people that were posting up, and they were down in southern Missouri at some places and putting it on there, and they were from Illinois, and I hope they had a good time. But I guarantee you those are some of the people that if they come back here and if all of a sudden they get tested and they're positive, they're not going to say, oh, well, I was in Missouri, I must have got it from somebody here in Illinois. So you got to weigh the option of that financial question. Is it worth that, or is it worth public safety? And I think we're erring on the side of public safety.
Okay. Chairman, another one that came in, kind of a lengthy question here. My question is more about the next level, the reopening of businesses. Rebuilding the economy is going to take more than just allowing the businesses to reopen. It's going to take the majority of us feeling safe enough to go out and participate in our local economy and spend money at these businesses. With the growing number of people being unwilling to even wear a mask when they go in public, what effect is that going to have on our ability to rebuild the economy? Though I know they tell us that the rest of the economy is going to recover, if the actions continue to make many of us hesitant to visit businesses and spend money once they're open, I highly doubt those that think wearing a mask violates their rights can rebuild an economy alone. What are your thoughts?
So, and we've listened to the economic experts. I mean, most say that you're really not going to see 100% recovery until there is a vaccine. You know, that's and then you have to determine how well the vaccine works, but you're really not going to be able to 100% get back to normal until everybody who wants to be assured that they're not going to get COVID-19 practically will be able to get that. Just like we get a yearly flu shot and we get boosters for all sorts of diseases and illnesses. That's the way it's got to be. But to get back to normal, the county's working on putting together an incentive program where we can help businesses restart up. And I think we've got tentative approval from the federal government and the state officials that are okaying the project. That's what we're going to do here. We're going to try to get businesses back on their feet and moving. At the same time, CDC's put out guidelines that they're going to say this is the safe way to reopen, and I'm sure our businesses are going to do that. And in that way, the public will have a comfort level that they'll be able to go back out, be able to patronize these businesses, and make sure once they open up that they stay open. And that's what we want to put a vibrant economy back in this county. And the way to do that is the responsible way to follow the medical advice. And once we get to that next stage, then we follow the CDC advice on how to reopen, and we keep these levels like we want to see them. And eventually we're going to get down the line, and there are predictions, it could be as early as fall, that there are early winter, that there might be a vaccination. We keep our fingers crossed and our prayers going that that's what happens, so that we can get this over with, get by this. And it's been an awful time for everybody, and it's time to get through it, but we've got to do it methodically with science, with those recommendations, and we'll get there.
Very good. Sam, a few more medical health department related questions come in. One of them in the Illinois Department of Public Health, St. Clair County is included in the Edwardsville region. How many hospitals make up that region, and how many of them are in St. Clair County?
So, and when I started at the health department, I always found this confusing. As St. Clair County, we fall into the Edwardsville region, and you would think that's Madison County, but as St. Clair County, we fall into the Edwardsville region. And for the Edwardsville region, we have 17 hospitals that comprise within the region, and 4 of those are in St. Clair County.
Okay.
It wasn't always called the Edwardsville region.
What was it called before?
Region
4.
Region 4, okay.
Well, and if you look on some of the charts that have been put out as part of Restore Illinois, there we're referred to as Region 4,
but it's, yeah,
tagged with Region 5 for that Southern Illinois. So.
There you go.
Next one here is, will we have to wear masks all of the time until we reach Phase 5?
So in the Restore Illinois plan, there are plans to continue to wear masks all the way up until Phase 5. And of course, if there's any IDPH or CDC guidance after Phase 5, we will certainly go by that guidance and take any information that they're willing to give us.
Okay. Another question here, it says, if the virus only lives a total of 72 hours on surfaces, why do surfaces still have to be disinfected if it's been longer than amount of time?
So we've always said, outside of COVID-19, hand hygiene and disinfecting things is always a good way to go. And so, that's still going to be the best way before COVID and after, to disinfect everything routinely and to just, have good hygiene across the board.
All right. Next one for Director Simmons. Will dentist's office be able to reopen in Phase 3?
They're open now. It's just that they're doing a certain type of procedure. So I would recommend that you call your local dentist and let them tell you what they're doing.
Okay. Chairman Kern, kind of goes into some of the other questions you've answered today. Since the governor did not reply to the request to open the county on May 15th, what is the next step you're going to take to have our county reopen? We can no longer wait since all of Missouri is open.
So just to add on to what Herb said about dentists, we had a dentist here a couple weeks ago, and he talked about there's a lot of spray that comes out from dental work, and so you're really going to have to look to your to your dentist for their guidance. Some may open, some may not, some may restrict procedures. They said if you need dental work, if you've got pain, if you've got some real problems, they'll take care of you. But they will open up, but I assume it's going to be with significant guidelines. And you need to talk to your dentist's office about that. The governor did respond to the request, and we wrote a letter, and we had many mayors in the county that also sent support. He responded, but really it's important that he had his healthcare professionals respond. They're the ones that called and said, let us see your numbers, tell us what you're thinking about, and we'll try to work with this. They're going to continue to try to work through that. That's why we put together these numbers every day, and we're going to continue to try to make the case to say that our numbers are improving. They're getting to a point where we think that we can open up a little more. Let's just continue to work through their process, and I think we can get there a lot more quickly than if we try to do something on a political level as opposed to a professional medical level.
And that's one of the new numbers that we're reporting on the quarantine days that they wanted to see. So that's being provided now. So we're doing what they're requesting.
Absolutely. Sam, a question that came in here is, how many of the confirmed positive cases were determined to be asymptomatic?
So when we receive test results, whether it be positive or negative, and whether it be from one of the testing sites that are out in the community or from the hospitals, we simply receive a positive or negative test result. We don't receive that information broken down as to if the patient were symptomatic or if they were asymptomatic when they were tested.
Okay. Another one that's come in says, do nursing homes take in positive patients that are being discharged from hospitals?
So what has been happening recently is that if a resident or a patient of a long-term care facility had to leave their facility and go to the hospital, they have been going back to their facility of origin. Now, if you were a new patient looking for a long-term care facility to go into, some facilities have policy and procedure as to how they're taking new patients and if they're taking any at all.
Okay. Try and grab a couple that have come in here today. I know we've had a lot of questions and we want to try and answer.
And we'll answer them if we can.
Are
Unless
there
there's
any
something you got
specific you see
Yeah.
that?
We have one here now that says, was the goal of the process to flatten the curve and not cure the disease? I thought the goal was just to make it so it was more manageable for hospitals.
I mean, Sam can answer that, but I think it's all of the above.
Mm-hmm.
We wanted to make sure when they didn't know of the levels that this would get to in our area, they certainly wanted to make sure the curve was flattened. But right now, the reason that we're asking everybody to go out and get tested is so we can isolate this this virus in the general population, and we can perhaps find out if we've got hot spots. We can figure out why in certain zip codes it's so high, and then we can move in and try to isolate the virus so that we slow or stop the spread in the county. The goal is, of course, to keep as many people from getting sick and dying as possible.
And as we've said, it has taken us how many months to get to this point. It's going to take us a bit of time to, get back to what we're going to call our new normal. So it's not anything that's going to happen overnight. And I think you're right when you say it's all of the above. It's not only keeping people healthy, it's not only flattening the curve, but it is also to find hopefully a cure and a solid treatment for this virus as we go forward.
Director Simmons, a question that's been on here a couple times today, see if we can get them an answer, is are our local first responders being made aware of where these cases are to help them better prepare for their response?
Yes, that's something that was started early on to where they're notified if they would get a certain address. One of the things that we really mulled over was the confidentiality, and with the help of our local state's attorney, Mr. Gomrick, we were able to get that worked out. So all of our first responders get notified of a code situation if they're responding to an address, so they can take the extra precaution. So yes, our goal was to make sure our first responders are notified and being protected.
And initially, Herb, the Department of Public Health thought that perhaps there was a HIPAA issue with
Yes.
that, and so this was something that we went to them and talked to them about this, and they eventually
Yeah.
understood why it was important to do this. So it isn't that the state is an immovable object.
No.
This is an ongoing conversation
Yeah, it was
with all
It
departments.
was a big thing. Like I said, we had to get Mr. Gomrick involved, and they first said no, but he was able to convince them, and now it's being done all over.
Very good. One last question that was submitted. We're joined by St. Clair County Superintendent of Schools, Ms. Susan Sarfati. Question about what will happen for summer schools this year.
Well, we've gotten guidance from the state board that school districts that do have summer school should be planning for that to be a remote learning, just as we've been doing for the last forever, it seems like, but the last good bit. So schools are wrapping up this week and next week, and the regular session, and diplomas are being handed out, and students are coming in to collect all their belongings, but summer school looks like it will be remote learning as well.
Do you know if any of the food delivery programs will continue, or is that's really going to be on a district by district basis?
And it'll be district decisions, but the USDA has extended their flexibility in allowing schools to deliver meals off-site like we've been doing since March 17th, and that can continue. If a student or a family is concerned about whether or not they can pick up those meals, they need to contact their local school district for direction.
So my son goes to college in Decatur. They've announced that they're going to have classes, that they intend to have classes at that university in the fall. Are you hearing that? That's certainly the desire of most people, I think.
It really is, and we're just now beginning to get guidance on what to plan for the opening of next school year. And as our state superintendent said, have plan A, plan B, and plan C, because so much can happen between now and the start of school. So stay tuned for more about next year.
And I know your office is responsible for approving the architectural plans that people are building schools and the inspections. Probably you'll be involved with making sure the CDC guidelines for opening schools is going to be followed too.
True. And school construction continues. They have been given some flexibility in how to do bidding and those kind of things. So the improvements like new roofs on schools is happening this summer, as was going to be planned prior to March. And
a lot of plexiglass is in your future.
I think there's a lot of plexiglass in all of our lives.
Right. Okay,
Thanks,
thank you, Susan.
You're
We
welcome.
appreciate it. And we want to thank each and every one of you who stayed with us today. We ran over time as usual, but it's important that we try to answer your questions. If you're going to take time and ask them, we definitely want to try to get you the answers, and we know that some of you are not going to be happy with the answers that we give you. Some of you probably will be, but we're your best source of information right now during this pandemic. I guarantee you probably got more information here within the last hour than you will from any other source out there. And that's what we're trying to do. We said that from the get-go. We want it to be update as much as possible, factual.
And Herb, I just want to point out that it brings us no pleasure to bring the bad news. And we hope that becomes less and less. That we will be able to have, this ray of sunshine that, hey, this is good news. And it brings us no joy to have to be here every single day for the past however many 65, 66 days that it's been. But as you said, it's crucial information that we have to get out there, because we don't, where else are people going to get it from? And we're just bringing you the truth, the facts, the raw numbers, and what we know.
It's
And
our
that's what
job.
It's our job.
It's our job.
It's our
We do
job.
it every day.
And we talked about that the other day. Nothing against the news media. They're covering news everywhere, all kinds of news. But if you look, you get a little blurb on what is in the counties where we're trying to answer your questions. And boy, we get a lot of them, and sometimes too many. But thank you very much. We'll be back here tomorrow afternoon with the next briefing at 3:30. We'll be back momentarily with Daisy and Cindy to translate this into our Spanish communities. Thank you, and have a good rest of the evening.